Good morning and welcome to Our Issues Milwaukee. I'm your host, Andrea Williams. Our focus this morning is on your health. My first guest is a reporter who covers public health for the Milwaukee Journal-Sentinel. He has won many regional and national awards for his stories concerning infant mortality, child welfare, poverty, urban life, and welfare reform. It's my pleasure to welcome Mr. Crocker Stephenson. How are you, Crocker?
Hi.
Thank you so much for being here. And you have a very interesting perspective when it comes to issues pertaining to public health. So I'm really glad to have you here to shed some light on some things, specifically here in Milwaukee. So the U.S. Census Bureau released statistics from 2013 stating that Milwaukee's poverty rate is 29%. That's nearly double the national rate of 14.8%. And that's leaving Milwaukee as one of the top 5 of the nation's most impoverished big cities. So it gets worse. Among children 18 and under, the poverty rate was 42.1%. And for African Americans, it's 39%, Hispanics, 31%, and for whites, 14%. When you hear those numbers, what do you think?
Well, it sure explains a lot about public health in Milwaukee. The communities that are most impacted, that are most vulnerable to to sickness and to illness and to unhealthiness are also the neighborhoods that are poor. In fact, I sometimes think about poverty as an illness more than as a some sort of force that acts upon people. Mm-hmm. And you can understand Milwaukee's struggles by understanding this economic stress, and the inequality in those numbers are just the things that are just so upsetting. We live in a city of not just 2 cities, but of many different cities that are almost unaware of one another.
Yeah, it's like light years away from each other. You go into a different suburb and it's like a whole nother scenario. So
and it's turned its back on the rest of the cities. The rest of the city or the metropolitan area, and so the struggles of those of people that are most vulnerable and live in the city itself, and particularly in the central city, they're almost invisible. Their needs are almost invisible.
Wow! And so some of the main drivers of poverty from just your coverage.
Oh wow! Gee, if somebody could figure out how to reduce the drivers of poverty to de-energize that driver, but mass incarceration, mm-hmm. Education, dysfunctional educational system. You have a disrupted family community. You have a disaffected young people that view us and them sort of sense of their future. They're the drivers of poverty. I mean, just public transportation, just getting from the central city to a job. There are no jobs in the central city.
Yeah.
And but getting out to Menominee Falls or getting to Cudahy.
And it taking an hour and a half just to get to work. It's just a lot of things that add to people's daily stress as well, I think.
Yeah, right.
Some of the most interesting findings when it comes to covering the subject of poverty, specifically here in Milwaukee, you just shared that with us, but we also have things that affect individuals across the state when it comes to public health. And mm-hmm. one of the latest things that we've heard about is the Elizabethae bacteria that has spread across some 12 counties in our area.
Right. Yeah.
What's the latest on that?
Well, we receive new numbers every week. About 17 people have died. About 45 people have been made sick, mm-hmm. and now we have 2 cases in Michigan. And nobody knows what is going on.
That's pretty scary.
It is. Don't be scared because you probably won't get sick, because the people that are getting sick are generally over 65. I assume mm-hmm. you're under 65, mm-hmm. and the
just a little.
And then they and are usually people with long and prolonged exposure to healthcare.
Gotcha.
And have underlying illnesses. But the Centers for Disease Control in Atlanta is here, and they have disease investigators. It sounds pretty like kind of a cool job, but disease investigators here trying to figure this out. And they're looking for a source, but they can't find one. And that it's spread across so many counties, and also now into another state. It's very confusing.
It is confusing, and infant mortality is something else that I mentioned that you cover as a journalist. Nearly 60% of Milwaukee's infant deaths are due mainly to prematurity. Then you have 20% birth defects, 15% sudden infant death syndrome. Your thoughts when looking at infant mortality?
You know, when we could have had the same conversation about infant mortality when we were talking about poverty. If you were to map poverty and infant mortality, you would find a huge overlap.
They go hand in hand.
They really do,
much,
that's because the drivers of infant mortality, the big driver of infant mortality is premature birth, and the big driver of premature birth is a healthy life. And healthy moms have healthy babies who grow up to be healthy moms who have healthy babies, and that is the cycle, the virtuous cycle that Milwaukee is trying to get going. But what we have is when you have neighborhoods in which a pregnant mom is stressed by gunfire, has to take a bus for 3 hours to get to work and back, has health care only when she becomes pregnant, has a fractured family support. All these sorts of things drive premature birth. And for a long time, for years, the city has been focusing on reducing sleep deaths, but has turned its attention more towards strong moms and strong babies, a message of health throughout the community. I think that's going to make a difference.
It has made a difference. In the State of the City address, Mayor Barrett had said that the numbers had dropped 14%. So that is a step in the right direction for sure.
The sad thing about that number, and that's
minority children are still higher on the numbers.
Right. Yeah. Even though the infant mortality rate has gone down both in the white community and in the black community, it's gone down a lot in the white community and gone down hardly at all in the black community. So the racial disparity that has been there for so long
still exists.
It's even wider.
Wow. So welfare reform, I remember when shortly after I had moved to Milwaukee, I thought it was really interesting covering the welfare reform under Governor Tommy Thompson and how different states were using the W-2 program as a blueprint. And really it has been used across the country. Yes. And now fast forward more than a decade later, you've got Governor Scott Walker, who is making some changes to welfare reform as well. One of those changes would be low-income residents being required to have jobs to receive food aid. And I want to know, in your opinion, does these type of decisions add to that picture of poverty?
Well, I'm reluctant as a journalist because I cover this issue to give you too much of my own opinion about this. But if you just look at the facts, when Governor Thompson introduced W-2, the unemployment rate in Milwaukee was less than 4%. That's virtual full employment. When employment rate under 4%, basically anyone that wants a job can get a job. And companies were crying out for workers. And so when President Clinton and then Wisconsin introduced these welfare reform policies, there were places for people to get jobs. Now fast forward to where we are now, where the unemployment rate has, while it has decreased largely, and while the unemployment rate is going down, it has virtually left the African American community behind. The Milwaukee Central City is still chronically unemployed. And as we've been talking about, there are no jobs in the Central City. You need to get out to these jobs. And then to say, well, get a job or your kids don't eat. Just looking at that through the lens of what is healthy, that does not strike me as a healthy position.
It's all very interesting to me, and these are the things that we talk about on this show day in and day out, and it's just interesting to me to get your perspective from a journalistic point of view. But child welfare stories in the city of Milwaukee, we've seen some that have really snatched the headlines, and they've broken our hearts,
really
even
broken.
just reading about some of the abuse cases that have taken place. One that particularly stood out was baby Christopher Thomas. And I remember reading one of your articles where I could tell that there was a passion behind trying to find answers and trying to understand how something like this could happen. You were having a hard time setting up an interview with the person that was leading child welfare. And I want to know, have you had an opportunity to really get in there and get some answers and find out how things are operating?
The Department of Children and Families is far more responsive than they used to be. And when Christopher Thomas was beaten to death by his aunt, his foster, his relative foster care provider, I'd never written anything about a child abuse death before. I had children, and I could not believe, and so I didn't know, what the rules were. And apparently there was this rules that you didn't call the person in charge to ask him how come a little baby has been beaten to death, that you were supposed to call somebody else. I called the person in charge.
Of course you did. That's what I would have done too.
And the secretary said, well, she's on the phone right now. Could she call you back? And I said, I'll just hold. And she said, well, I don't know how long she's going to be on the phone. I said, well, will she be on the phone for 20 minutes? And she said, well, she might. And I said, how about 3 hours? Will she be on the phone for 3 hours? She said, she might. And I said, is she just sitting, like, can you see her right now? Can you just, like, look to, and say, hey, there's a baby that's been beaten to death, and the people want to know why and how that could happen. And this child was receiving all kinds of services when this happened. And you're responsible for this child. You took this child out of this child's home and put this child in another home where this child was beaten to death. How does that happen? You got to talk to us. And so I wrote a story about how
you couldn't talk to her.
They wouldn't talk to us. And we continue to write many at the Journal-Sentinel. Continue to write many stories. Unfortunately, many children were beaten to death that year. That was just a terrible year. And 2 children were starved to death in their mother's care. Starvations are so rare. And it was a terrible year. And as that year unfolded, a warmer relationship developed. First of all, I began to understand how difficult it was to provide child welfare. And then, so we insisted, a law was passed now. Now when a child dies, the state has to immediately notify everyone. The entire state gets notified that a child has died while in care. And then within 3 months, the state has to report what services that child was getting.
Wow.
So the big wrestle to get someone to take accountability and to be responsible for these children, that law's changed.
Okay, we've quickly run out of time, so I have to have you tell the viewers at home about this article that you wrote that was dealing specifically with African Americans and Alzheimer's, and that's what got my attention, and I wanted to have you here to talk about it. So what made you write that particular article?
About, about 4 months ago, a study came out in New England Journal of Medicine. It was called it was looking at a group of people in Framingham, Massachusetts. And the article said that the Alzheimer's rate had decreased about 20% a decade for the last 3 decades in this community. So I thought, wow, that's great news. And the causes were probably people were eating healthier, people were not smoking. They were doing all kinds of things to help their heart, which helps your brain. And so I was talking to the folks at the Alzheimer's Association. They said, the problem with that study is that everybody in it's white. I mean, it doesn't really speak to the larger population. The rate of Alzheimer's among African Americans is twice that of whites, and it's very hard to get Black people to participate in Alzheimer's studies or any medical study. And being white, I was like, why? And he said, well, why don't you find out?
And that's where the ball started rolling,
yeah,
right?
and you know, there's a sad history. History is certainly one of the issues that you go crashing against. And we talked about Henrietta Lacks, a woman who in 1951, doctors at Johns Hopkins harvest some of her cancerous cells, and those cells have gone on to become what's called the HeLa line. The He is Henrietta, and the La is Lacks, and those cells have been used to cure polio. They've been sent into space to see how cells multiply in zero gravity. They've been the foundation of one healthy serum after another.
Wow.
And the family
and her family gets nothing.
Her family was never even notified.
Yeah. Wow.
And so that sort of disrespect and disregard for this woman as a human being, you know, that story is still in people's heads. Her children are still alive. There are still issues that come up. In 2013, somebody in Australia did a genetic profile of her cells. So one of the most intimate things you have is your DNA profile, and this was now published that in a medical journal without the family's permission, knowledge, or input.
Very intriguing story, and that's going to lead us to the second half of this show. I thank you so much for coming by and just sharing your thoughts, and I just encourage everyone to check out Mr. Crocker Stephenson. He is a reporter that covers public health for the Milwaukee Journal-Sentinel. You can follow him on Twitter at Crocker_MJS. When we return to Our Issues Milwaukee, we'll focus on the subject of Alzheimer's and find out more about two organizations whose goals are to help those battling the disease. We'll return to Our Issues Milwaukee right after this.